Anxiety. What is it? Well, it's been described as a feeling of worry, nervousness, or unease about something with an uncertain course, or an intense, excessive, and persistent worry and fear about everyday situations. Do you recognize this thing we call anxiety? We've got plenty of that today, haven't we? And it can induce a fast heart rate, rapid breathing, sweating, and feeling tired. So interestingly, the iris does show predispositions as far as our mental qualities are concerned. And in the Integrated Iridology iris chart, you'll see that the upper sector, which is coloured green, contains 10 different areas that have a physical brain location, but also indicate aspects of our actions and reactions as we interface with our world. So I thought I'd do a little lesson today on what we can learn about the position referred to as the anxiety position, which is between 55 and 60 minutes in the right eye and 60 minutes and 5 minutes in the left eye. You can just see this position here. And if you look at these examples, we've got a right eye and 3 left eyes. So the anxiety zone has been demonstrated at the clinical level to be the most common area in the cerebral zone with markings. And these markings are created, if you will, in utero. So one big question we should ask if we've got anyone with signs in the anxiety sector is, what kind of pregnancy did their mother have when they were carrying this person? Because that can influence the outcome of the structure in the iris. The physical location that we're looking at is actually the midbrain or the mesencephalon, which is the forward portion of the brain, which serves important functions in motor movement, particularly movement of the eye, as well as visual and auditory processing, sleep and wake cycles, and also temperature regulation. The brainstem has many basic functions, including the regulation of heart rate, breathing, sleeping, and eating, all of which are affected, by the way, with anxiety. So it is situated in the iris directly opposite the adrenal glands. So in this example, we can see that there's a break in the collarette in the adrenal glands, which can weaken the adrenal glands or their ability to cope with excessive worry. At the physical level, what does a sign in this area indicate? Well, on all iris signs, we gauge the significance by the shading. So when we have light signs, like we have here, light signs, it indicates a hyper function, whereas dark signs, depending on the amount of darkness, will indicate reduced responses to that condition. So light signs in the anxiety zone indicate the potential for both mental and emotional anxiety, producing adrenal depletion and possible thyroid problems. So when you see a light area, always check the thyroid gland, which in this case is dark, because the thyroid is a very important part of our anatomy, which controls many of our functions. And one of the things to keep the thyroid healthy is to learn to have your say. So if there's something that's making you feel anxious, it would be exacerbated if you were not able to discuss what it was that was causing the anxiety. So just to recap, light signs indicate a predisposition to hypersensitivity towards conflict and chronic worry. Now, if they're dark signs, This can signify diminished function or vitality in the associated area. The client with dark signs in the anxiety zone can complain of feeling shaky periodically, even though there is no apparent causation. And some will develop a sweet tooth in response to adrenal weakness. So it's not just the pancreas that causes us to crave for sugar. The adrenals are looking for that extra pickup, and so it's easy to develop a sweet tooth to cope with anxiety. One thing that you should do if a person is experiencing chronic anxiety, and especially if they have these markings, is just keep an eye on the blood pressure. Now, what about at the emotional level? So if the signs are light, this does not necessarily indicate an acute active condition, but rather it's about the disposition to hypersensitivity. So throughout their life, they tend to over-respond to things that cause them anxiety. So it can provoke extreme personality traits, including fanaticism, obsessions, fervor, even hallucinations at worst. So their inclination to overindulge in conflict and worry can definitely strain their adrenal glands. At the emotional level, if we have dark signs, this person can display antisocial behavior, including disrespect, misery, contempt, and intolerance. They have the tendency to brood over the past, which can instigate depression. And oftentimes you'll find that if people have a very dark mark in the anxiety zone, it can indicate that they've got a tendency towards hypochondria. So they're always thinking, am I going to get sick? What is that pain I've got? Could that be something terrible? So just keep these things in mind. Now, these images are taken from page 61 in The Mind Matters, the emotional aspects of integrated iridology. And so looking through them, just to recap, the little arrow here is pointing to a light sign in the anxiety zone, indicating a predisposition to hypersensitivity to conflict and chronic worry. And stressful situations can weaken the adrenal glands, which is compromised in this case by a broken collarette. So when we see a break in the collarette, it means that there is disharmony in the connection between the sympathetic and parasympathetic responses. So this will heighten reactivity to a person who has light signs in the anxiety zone. In figure 3.22, we have darkening here in the anxiety zone. And this is a male and it's a left eye. And the tophi that you see here, these indicate the tendency to avoid confrontation. People with this sign really do not like to have to confront anyone about anything that's making them uncomfortable. And so this will increase this person's reaction to anxiety, make them worry even more because they haven't got the ability to speak. Now, also speaking about that, notice this section here has an opening in the thyroid gland. And we mentioned that very often when we see the anxiety zone marked, you will find that in connection with the thyroid gland. So it's very important that you teach your client that they've got to have their say. They've got to speak to someone who can solve the problem for them, or just a listening ear about whatever it is that's making them anxious. In this particular example, we've got darkening in the anxiety zone. This is a female and a left eye. And notice that there is a peripheral contraction furrow just running through this darker marking. And that will increase the focus on this area and the impact the anxiety can have on the client. I would question them about anxiety-based headaches in this case. And in the last example here, we've got a lacuna and quite dark in the anxiety zone. This is the left eye of a male. And note the very open structure here and also that they have a developing corneal arcus. That's what this yellow arrow is pointing to. So a corneal arcus indicates a reduction of vital oxygen in the brain area, and that will further add anxiety if they can't remember what it was that they had to do, or perhaps they get caught up in time management where they've lost their timetable, or they're running late and it's making them more anxious. Having a corneal arcus will add a dimension to any of the marks in the cerebral zone. And this client admitted to increasingly moody behavior and depression over the last couple of years. So I hope that this little section has spiked your interest in learning more about the cerebral sector. The Mind Matters book also contains support methods that you can offer to people with various markings, as well as supplement recommendations. So I'm sure that you'll enjoy those if you're in clinic or even if you're studying. This adds a whole new dimension to what you learned already about physical iridology.